Good afternoon, everybody. Very nice to see all of you here again. It's also a pleasure to have Chancellor Malatras visit again. It's a great day today. The vaccines have been here for a couple of weeks. We now have vaccinated over 6,000 of our staff. I think about over 100 have received their second dose, so hopefully they will be fully immunized in a couple of weeks. And today we also hit 100% of our allotment for this week. So we are on track to do almost 1,000 vaccinations every day. And we're very optimistic about protecting our entire workforce in the very near future. This is also very nice because we have Chancellor Malatras come back every time we have a major event, whether it's the best saliva test in the world or Dr. Thomas leading the vaccine trials. So we hope to have something very positive that we can sort of celebrate together and welcome Chancellor Malatras back again. So welcome, Chancellor.
Good afternoon on this very quiet day in the United States of America. In all seriousness, although there's a lot going on in this country, I think it's important that on one of the most severe days of COVID positivity and deaths in this country, that places like Upstate are continuing to do the job. So it doesn't matter, right? COVID doesn't stop for anything. You have to constantly be addressing this problem. That is what Upstate is doing every day. I'd like to thank President Dewan, who has done a fabulous job at the helm at the university, and CEO Corona and his team for all that they're doing. I came today. I've been traveling around the state and of our system. I visited SUNY Downstate, which is our downstate university hospital, yesterday. They completed 100% of their vaccines that they've been distributed so far. And as President Dewan mentioned, I came here to visit the vaccination site to see how it's going. It's going extraordinarily well. I met with the nurses and the phlebotomists and the pharmacy students and the pharmacists who are helping coordinate this massive operational exercise of great importance. Even people are giving up their week off to come in and help support the effort. We met a couple of those folks here as well. 100% of the first shipment of the vaccines that SUNY Upstate Medical has received, they have administered. SUNY institutions are at the top of the list. The state announced that today, and it's just a testament to what SUNY can do when they're given a major challenge. And you've seen that time and time again at Upstate, and I'm really proud to be chancellor of a system, especially with Upstate as the foundation of our hospital response. In the spring, sending our staff to hospitals that needed staff in an emergency, to developing, as President Dewan said, the #1 saliva test in the world, not just New York, in the world for detecting COVID. What's important, what we're finding is, unfortunately, the UK strain, which we hoped would not arrive in New York, is here. There was a case found in upstate New York in Saratoga Springs. Luckily, the test that Dr. Middleton and his team have come up with can detect the UK strain, which is really important in managing the crisis as we constantly find new curveballs thrown our way every day with COVID, 100%, which is great. And then finally, managing the winter wave that we're experiencing right now. We know there's been stress on the hospital system. That is something that we continue to be mindful of, but SUNY here in Upstate is meeting the challenge. I have, this is an all hands on deck affair. So we have actually had one of our senior health experts who work directly for me, Stephanie Fargnoli, who's joined us here today, come and be embedded here at SUNY Upstate to help manage any issues that may be coming up as we're managing just the ongoing crisis. And then finally, which is really important for us, is as we are starting to ramp up the vaccines more broadly, as we're getting more shipments in, we're getting more doses, as we're starting to build the capacity to expand to the broader public, we have asked our SUNY students to step up in a big way. And we've asked SUNY students who are currently in medical programs who can administer the vaccine to volunteer. Yesterday, I mentioned that 800 already have signed up. As of today, we have 1,900 students who have volunteered to administer the vaccine as it's needed. That just goes to show you everyone wants to give back. They're not doing it for money. They're not doing it for college credit. They're not doing it for glory. They're doing it because they want to help their community. So I am proud to be here today. I think the site is a wonderful thing to see in operation. 100% of the doses administered. That's big news for Upstate. It shows that when SUNY is given a task, we will do it extraordinarily well. So I just thank President Dewan and the entire team for inviting me here today, and I will answer any questions that you may have. Only the easy ones.
I don't have easy questions.
Well, then, Andrew Donovan, you're not allowed to ask any questions.
Just explain for us some of that data. So 100% of the first shipment, does that mean the vaccines being now are all second doses, or is there continual shipments for people's first doses?
So we received basically at the middle to end of December, the first major shipment. All 5,000 plus, close to 6,000 of those doses have been administered. We recently got another shipment this week for first doses, as well as the second dose. That's now both well underway. So we move to the first shot, as well as the second dose for the employees here. SUNY Upstate. We're getting constant shipments on a schedule. SUNY Downstate just received another batch as well as Stony Brook, our other medical center.
And when we say first shipment, that's the Pfizer vaccine.
Pfizer, Moderna, they were both sort of shipped in December at the first round, and now we're continuing to get new shipments bi-weekly or weekly, depending what the schedule is. Any other?
Why do you think it's going so well here compared to other places across the state?
Well, being chancellor, I have a little bit of SUNY swagger. I think our commitment to helping out during this crisis is unparalleled. I think when the story is sort of written on the COVID response, you just see time and time again, SUNY students, faculty, staff, researchers, innovators stepping up in big ways. I've gone all across this system. We had students producing face shields in SUNY New Paltz using their 3D machines. SUNY Upstate developing the world's leading test, right? You just see time and time again, I think we have a lot of intellectual firepower at the State University of New York. We are the largest system. We're pulling all of our tools and all of our assets in a time of absolute need. I think that shows you that public higher education can lead the response when given, and we have a lot of tools in our toolbox to really take out when the time is needed and help others. It's not just the system. We've been deploying nurses and healthcare personnel to other hospitals. We're testing outside of our system to help other institutions. So you see it time and time again that we can meet these challenges because we have all of the human capacity to do so, and we're going to use it because the time is now. We don't want to hold anything back in the middle of a crisis.
It's been said that SUNY campuses could play a large role in helping to get the public vaccinated. Can you tell us what that would look like and how far along in the process you guys are in that?
I think that's underway as we speak. Right now, 5 of our community colleges, which we'll be putting more information out later about, we don't want to overwhelm them right out of the gate, have already agreed to be distribution centers for the vaccination process. You're going to see more SUNY campuses join that. I think we have an important role to play here because we've been able to do this on scale when it even comes to testing, right? A testing operation was a massive operation. Every one of our campuses had to test. So we already have the capacity and the operational know-how to do it. I think you're going to see many of our campuses play a really important role as it goes out. And just think about the volunteers. We just asked our students who could do this 2 days ago whether they'd be willing to volunteer. We already have 1,900 students said, sign us up. Where do you want us to go? I think we're going to get thousands more students across the system, not just administering the vaccine, but the other operational pieces too, signing people in, testing people, all the things that are important roles in a process like that. I think you see that human capital that we have, but we also have the geographic reach as well. We are in every part of this state, Long Island all the way to Buffalo, so we're going to use all of those assets to help the state of New York because we want people vaccinated to get beyond this crisis because ultimately we also want to open up our campuses again fully and have our students come back.
Of course. Just a quick follow-up. Can you tell us mechanically what that's going to look like? Is it going to be different per campus? Let's say I go get vaccinated at SUNY
Yeah.
What is that going to look like for me? Am I going to drive up in my car?
I think you're going to work on that. I think sometimes you're going to have potential drive-through vaccination sites. Sometimes you're going to go into a gymnasium. I think they're going to set it up by region as needed. I think in like the city of New York, where we have some of our campuses, that's probably going to be more of a walk-in operation. So I think we're going to adapt to what the community needs, and we're going to create as much capacity as possible in multiple different ways.
You know, people are pleased with the way the hospital systems have begun vaccinating its own staff. But now the next phase is everybody else. And we've heard you talk about this with the governor at his briefings. What do you make of the tension right now between these already established county vaccination plans, which they claim are dusted off every single year and renewed, but also this seemingly statewide new plan to vaccinate? Why isn't there more coordination?
You're seeing unprecedented cooperation. So just take what we're doing right now. Our community colleges are working with the county health departments and the state. This is an all hands on deck approach. There's no problems among the actual different levels of government or public institutions versus private institutions. We are all cooperating. We're all rowing in the same direction. So I think you're going to see more of that as it gets broader to the general population, right? This is very specific in the first round to get to our frontline workers, our healthcare workers in order to inoculate them. But now as this is broadening out, you're seeing counties work with our community colleges at SUNY. You're seeing them work with state. There's an unprecedented level of cooperation, actually.
Are you happy with the total number of vaccinations in New York?
I am happy when we get all New Yorkers vaccinated. I think this is a process. I think you have to be impatient and never let your eye off the ball because you see cases increasing. The virus is still here. I have more people tell me, I'm sick of you coming and talking about COVID. I'm sick of me coming and talking about COVID too. But the number of cases are growing. Hospitalizations are rising. We have to win the day by getting people vaccinated. You give us more shipments at the State University of New York system, we'll inoculate people. You give us the shipments, we'll inoculate people. You give us the shipments, we'll inoculate people. We've demonstrated we could do it. The federal government keeps giving it to us, we'll keep doing the right thing.
Will students on campus next year be required to have a coronavirus vaccine to be on campus, regardless if it's exempted?
I think we're going to have to talk through some of those issues. I think that has to be a larger issue. Our students have already started engaging in that conversation. We've seen overwhelming support from our students to want to be vaccinated, as getting tested as well. Our students have done a fabulous job getting tested. They're still getting tested. We have many clinical students on campus today getting tested. We've done like 630,000 tests at this point. So I think you see a willingness of our students to want to. For these other cases, we're going to have to talk those things through and see how it goes.
Is Upstate only vaccinating workers right now?
That's correct.
Upstate has been vaccinating our own staff as well as staff from the other hospitals in the 5-county region. So we've vaccinated staff from St. Joe's, from Krause, from Oneida, from Oswego, from Auburn, and from Cortland. And so when the vaccines come in certain allocations, we get the vaccines into the arms as soon as we can get the people here. But because we have to control the vaccine, the Pfizer vaccine, because of the sensitivity of keeping it in deep freeze, we have to have the individuals from those staffs come here. Now those institutions are getting their own allocations as well, and so as it spreads out, as the Chancellor and our President said, we'll just keep vaccinating. As long as we get vaccines, we're getting them in the arms. We have the motto, no shots on the shelf.
And what type of workers? No, you can stay there. Because I just want to know. Because actually, Chancellor, the county doesn't know these sort of things because this program's being run by the state. So when we ask those questions, you know, our county executive doesn't necessarily know. So we would like to know what kind of the workers are getting. Are these frontline COVID workers? Are they other administrative people?
So we're following the phases to the letter. 1A, right now we're in phase 1A. We're in constant communication with the county executive in Onondaga County, and we're communicating with other healthcare departments in the other counties. So it is a cooperation. We're sending vaccines to them. We actually had a conversation yesterday about taking extra vaccines that are put back into the hub, because remember, Upstate's not only responsible for itself, it's the regional hub for 5 counties. So we're working with everybody. We just had an advisory committee meeting today, and we will be getting vaccines out to all the county organizations. It's a really good, well-run cooperation.
And just my question real quick, I'm wondering, what will the logistics look like when you expand the phases? Upstate? Will Upstate be bringing vaccine to the on-center for the public to go there? I'm wondering when the phases open up, what the plan is right now.
So the hub has an operations team, a logistics team, a planning team, a health equity team. We will make sure that we get the vaccine into the arms wherever they may be.
All right, thanks, man. And Chancellor, just one more question. I'm sorry. Who makes sure that Upstate is delivering the vaccine to the appropriate people? Because this is a state. So is the state sort of how does the state keep track to make sure Upstate is delivering the vaccine to the appropriate?
Well, I am keeping a very close eye as Chancellor on the activities, and I mean that seriously. I think this is an important thing for the state of New York as well as our system. And we're working very closely with the State Department of Health as they are administering here to make sure everything is going seamlessly, and we have seen no issues with any of our SUNY campuses. And just to the larger point of cooperation, I think the Central New York, Syracuse region has been a model for cooperation. I think County Executive McMahon, who I have been talking to pretty regularly, or the mayor of Syracuse, has been working extraordinarily well together with SUNY Upstate as well as the broader community regions. So as this expands to broader communities, I think you're going to see a quick process in multiple areas with a lot of experienced healthcare personnel to do this. So I'm confident that once that happens, we stand willing and ready to go.
President Dewan, you were shaking your head when I asked Dr. Corona his question. I was wondering if you have anything to add about the coordination to get the vaccine to Onondaga County people. Is it you delivering it to the on-center? I'm just wondering if you were nodding your head, so I didn't know.
No, again, I think he answered it pretty appropriately. It's a lot easier to deliver it once we get the Moderna vaccine. So that will be what we can spread out.